So basically, yesterday we talked about cerebrum. In the cerebrum, we have different lobes: frontal lobe, parietal lobe, temporal lobe, occipital lobe. So we already studied about two lobes, that is frontal lobe and parietal lobe. So what is the main function of parietal lobe or and temporal lobe is mostly motor function. Motor function, whatever motor function you perform, that is from the frontal lobe, and as well as speech you are giving. Speech is associated with left side of the brain. Okay, left side of the brain have speech area that is known as Broca's area. Okay, and as well as whatever skills you learn, it is from the premotor area. And we have orbitofrontal cortex, okay, which is helpful for social behavior. Okay, so this is the uh, రండి అమ్మా రండి so whatever kuch better so whatever the social performing activities are associated with orbitofrontal cortex. So which area is if undeveloped, so what happened? Which area is undeveloped, so the symptoms will seen on your body. Okay, so this is all about frontal lobe. Next we have, this is parietal lobe. This is parietal lobe. Okay, you know, this is the parietal lobe. Parietal lobe, what have? Mainly the parietal lobe has sensory receptors. The sensory receptors, mostly the taste areas. Okay, what is the sense you are getting on the skin, you will reach to the brain, to the parietal lobes. Next we have temporal lobe, occipital lobe. So these are the very important lobes. Okay, kindly give 1 minute, friends. So today we will talk about temporal lobes. So where is the temporal lobe? If you see in the diagram, the temporal lobe is present in that area. Okay, so it is the temporal lobe, mild green color. Okay, you can see this is the temporal lobe. What are the things are available in that area? You can see auditory association area. Auditory means hearing. Auditory area. This is the auditory area. Auditory associated area. Okay, this is the main thing which is available in the temporal lobes. The olfactory area, in the olfactory means the whole area which is concerned about listening. Okay, hearing. Okay, whatever I am hearing, I am talking, you are listening, so it is associated with the temporal lobe. Okay, so what, how this happening? Temporal lobe, this is the lobe receive receptors in the nasal cavity of the sense of sense of smell. Sorry, so here I got confused about. So basically olfactory means smell area. Okay, the smell in the nose, in the nasal cavity we have receptors. Whatever aroma or whatever a in the environment, if there is smell, so it will receive, it will catch it. Okay, what is the source? Smell of the milk, smell of the fire, smell of the oven. When uh, when you cook a biryani in your house, the smell flies. Okay, so the smell also enter into your nose. So how this happening? Because of in the nasal cavity, we have receptors, smell receptors. It will receive and it will reach to the temporal lobe. So in the corona, so when some patient lost smell, why this happening? Because the reaching of virus, coronavirus, into the lungs through the nostrils. Okay, it only affect through the nostrils. That's the reason most doctors advise masks. Okay, so when you enter into the nostril, first it will affect the nasal cavity. Okay. First, it will affect nasal cavity. If it will affect nasal cavity, okay, what will happen? The receptors which are present on the surface of nasal cavity, it will got affected. Okay. So you can lost some receptors. So if you lost some receptors on the nasal cavity, what will happen? You are unable to smell. So that's the reason the patient lost smell in the coronavirus initial days. So if he lost the smell, the coronavirus is affecting is starting on the nostril only. So it by the time of it reach into the lungs, its duration will end it. So from day 7 to day 9, day 15, the effect of the coronavirus is highly deadly. So some patients having doesn't have any small issues, any symptoms. It means that the coronavirus affected directly on the lungs. ओके. सो क्या हो रहा था कि नोस्ट्रिल्स में इफेक्ट करने के बाद अगर नोस्ट्रिल में इफेक्ट नहीं किया तो डायरेक्ट वो लंग्स पे इफेक्ट करता था. इफेक्ट करके वहां पे सिम्टम आए तक आपको बहुत ज्यादा कोरोना वायरस फैल चुका होता. तो बेसिकली टेम्पोरल लोब हैविंग वन sensation, that is smell sensation. Okay. And next is auditory area. This is the auditory area. As their name suggests, receive impulse from receptors in the inner eye for hearing. The auditory association area is a quite large. Part of it is concerned with the meanings of words we hear, that is with speech. Other parts are of the interpretation of sound, such as thunder during a storm, and ambulance siren or baby crying. Without proper interruptions, we would hear the sound, but would not know what it means and could not respond appropriately. So means the auditory area is very large. So it is below the speech area, means whatever speech you are giving, you are talking, it is reaching to another person, he is able to understand because of hearing auditory area. And the auditory associated area is helpful for different types of sounds, like uh, siren sound. When ambulance go, the siren sound reaches to your brain temporal lobe. What does this mean? It is informing to you, please give side. Okay. If your obstacle going to the ambulance, okay, it will decrease the or increase the level of timing to reach to hospital. So then the siren sound hears, you want to give the side to the ambulance. Next, baby crying sound. Okay, different types of sounds will reach the associated area. Associated area. Okay, so that's the reason the temporal lobe have auditory area with very vast area. Okay, also it is temporal and parietal lobes in the left hemisphere or other speech area concerned with the thought that precedes speech. Each of us can probably recall times when we have spoken without thinking, but in actually that is not possible. The thinking takes place very rapidly and essential in order to be able to speak. So basically, there are some areas also there which probably recall, means whatever you talk sometimes without thinking, means you think in a rapid way, you give answer to that question. Okay, so this is happened within seconds, within milliseconds. So it will recall, vehicle recall. Okay, so this is all about temporal lobes. What does temporal lobe have? Temporal lobe have auditory area first, and the temporal lobe have olfactory area and auditory associated area and a recalling capacity area. So these are the four minimum highly important function which is done by temporal lobe. Okay, this is the temporal lobe. Frontal lobe motor. Okay, premotor area and orbitofrontal cortex area, and this is the temporal lobe. Parietal lobe have sensory association area, general sensory and main sensory area. Next we have temporal lobe. So this is the temporal lobe. Let's talk about, sorry, occipital lobe. So what is the occipital lobe for? Occipital lobe is for visualization. What? It have visualization area. This is the visualization area, visual area and visual association area. This is the main important. Olfactory, smell and hearing is for parietal, temporal lobe. Speech for temporal, sorry, temporal lobe. Okay, speech and sense, it is for parietal lobe. Okay, but for visualization it is for occipital lobe. Occipital lobe. Impulse from the retinas of the eyes travel along the optic nerves to the visual areas in the occipital lobes. This area, the visual area, sensation area, it interprets what is seen and enable to think in cerebrum to use the information. Okay, so here what it will, we have retina. In the eyes we have retina. Okay, we have nerves. Okay, okay, we have nerves. So it is connected to the retina. Then the retina are connected to the visual area of occipital lobe. So what it will go, it will visualize, visualize and give the information about the visualization to the cerebrum, cerebrum, thinking area. From where we think, it will reach the visualization area to the thinking area. Like example here is giving, like we are seeing one clock, okay, and we are interpreting that what is the time now, and we are understanding, okay, how this is happening. Our retina have the image, it will underwent to the visualization area, visual area, then visual area, it will uh, it will pass the information to the cerebrum, thinking area, whatever the thinking or cerebrum information taking area. Okay, then it will understood that this is the clock. Now what we have to do with the clock, what we have to do, we will see the time. Okay, we can use simply that information such as hurrying a bit so as not to be late to class. So why we see the clock? Why we use the clock? Because if any delay will not happen. Okay, if any work, I am not reaching that area. Okay, what we have to do, and what time I should wake up. There are the number of things. It will, we will see the clock. Okay, and as well as judging the distance and seeing in three dimensions. And visual area is also helpful to go through the particular area. Act like there is no specific thing that in front of us, like the main road is there, four ways are there. So when you see the area, what will the visual area pass the information to the cerebrum, first thing. And the second thing, when the cerebrum receive the visual information, what you need to do, I have to go through this direction. You can't see the what happening, but you are imagining, you're imagining, you want to imagine. So when, what time it will take. Okay, so I will reach by 7:13. Okay, and I will do my work on that area. So your imagination, by seeing the visualization, you are interpreting and thinking how the work to be done. So this is also happen in the occipital lobes by the help of cerebrum. The cerebral cortex has the set characteristic of neural plasticity, the ability to adapt of changing needs to recruit different neurons for certain functions, as may occur during childhood or recovery from a stroke. Another example is the visual cortex of a person who is born blind. The neurons in the occipital lobe that would have been used for vision will often be used for another function, Some may become part of an auditory area that is used to localize sounds and estimate the distance. Those of us who can see may or not rely on hearing for localization, who simply look at where we are thinking the sound came from. A blind person cannot do this and may have an extensive mental catalog of sounds, meanings of sounds, distance of sound, and so on. Some of these in the part of the cortex that normally is for vision. The younger the person, the more plastic the brain. The brains of children are extraordinarily adaptable. As you get older, this ability diminishes, but it's still present. So basically, here we have the neural plasticity. We will talk in coming classes. So basically, this is very another way of working of brain. Means whenever uh, the situation changes, the mind will think according that. Okay, something happened. Some if any problem came to you, like suddenly you're going on the path. Suddenly anyone attacked you. So when our our brain will adapt the situation and it will want to fight on that situation, but it initially it is not acceptable. It is not in the situation that it will fight to that persons, but it will adapt the situation and it will want to, if the person is mentally stable and strengthy and physically strengthable person, he will fight with them. Okay. Sometimes what happen uh, in the life, there are multiple issues will happen. Suddenly someone lost his money, someone lost his bag. Okay, someone lost someone, so it will adapt the situation and it will perform like that. And as well as some diseases also happen, like stroke. Okay, in the stroke also, if the certain area of the brain will not work, the another area of the brain will want to recover or want to work the things which are needed from that area. It will work by another part of the brain. Okay, so this is very important. So another example is given like here. Some patients, some people during their birth aren't able to see, blind birth. Okay, during the birth they are blind. What will happen? The visualized area is converted into auditory area. So what will happen? Their hearing capacity is much more increased than a normal person. They will able to listen the sound. If any pin also drop from the height, they will able to listen. But one thing is that they cannot imagine that this is coming from that area, from which direction the sound is coming. They can able to listen that sound, but from which direction the sound is coming, they cannot imagine that. For birth blind people. Okay, so I told you the neural plasticity means the brain will adopt the something which are been lost. Okay, so it is much more in younger person. If a younger person have any brain injury, it have the 90 to 95% chances are there he will recover. In the children it is much more than, but in elderly older patients or older people, it will gradually decrease. Okay, so this is how the brain works. So we have occipital lobes. Okay, we talked about temporal lobes, we have parietal lobe, and we have frontal lobe. So again we will revise by seeing this diagram, that the frontal area have mostly, it is for motor function and as well as speech. Mostly the left side of the brain of frontal lobe have speech area. And second thing, you can What are the functional skills you want to learn? You will learn with premotor area. And the social behavior you want to improve, that is orbitofrontal cortex. Okay, next we have parietal lobe. Parietal lobe is mostly given for sensory area. Okay, and the temporal lobe is for olfactory smell and auditory hearing, and the occipital lobe is mostly for visualization. So whatever we see after the seeing that interpretant, and whatever may be the decision you want to take, you will take by this visual area. Okay, and as well as we learn that neural ca- uh, neural plasticity neural plasticity. Okay, so next we have associated area. What are the association areas? Association areas mean that it will they are the not either part of the frontal lobe, they are not the part of the parietal lobe or occipital lobe, but they are in the brain that will work different function, they have different work. Okay, so association areas, we will talk about association area, I think, and basal ganglia also we will talk, and corpus callosum. So I think the time is remaining only 4 minutes. Please rejoin, we'll continue. Okay.